Hi everybody, this is Carol from the Society of Thoracic Surgeons. This is the monthly webinar for the Adult Cardiac Surgery Database for July 1st, and we're going to get started here. On the agenda today is welcome and introductions. On the line with me from Iqvia, I have Melanie Bent, Paul Meehan, Joe Brower, Jean, and I think that's the whole Iqvia team we have on. And then I have with us from STS, I have Jane Hahn, Leanne Jones, Eddie Dolan, Emily Conrad, and Melinda Offer. I don't think I forgot anybody. Okay, so we're going to get started here. Just a couple, we'll go over some housekeeping and then some STS updates. We're going to go over the Aorta section again, and we're going to go over then the Q&A section, and we also have an Iqvia update. So first, want to welcome version 4.20 starts today. And what that means is that all cases with OR dates of July 1st and after will need to be abstracted using version 4.20.2. And then any case prior to July 1st, so OR dates ending June 30th, 2020, back to July 1st, 2017, will need to be abstracted with version 2.9. If for some reason your vendor software is not yet updated at your site and you don't have access to version 4.20.2 software, you'll need to abstract, and you want to continue abstracting your cases before you get that software installed. You'll need to use paper data abstraction forms for version 4.20.2. Those have been updated. We're going to go over a couple of the small changes that took place. Posted. I think we posted them up there yesterday morning and then sent out an announcement email that they had been updated along with a few other announcements in that email that we'll also cover in this webinar. So you'll need to use those forms, and I'll show everybody where those are at towards the end of the presentation. Okay, so the data spec update, the vendors are in the process of being certified. We have 2 phases of certification. For those who may not know how this works and how the vendor's process works, is there's 2 phases of certification. Phase 1 of certification is certification on the build of the data specifications. So to make sure that the parent-child field logic is working, to make sure that the choices are in the fields, to put some checks in to make sure the data is clean when it's coming, or at least clean when it's coming into the Iqvia data warehouse. And then there's a phase 2 part of the certification, which is the risk model certification. The risk model certification, we didn't change risk models between version 2.9 and version 4.2, but because of we had some mapping changes, which means that variables that are used in the risk model are getting pulled from different sections of the data collection form. So DCRI, who is our data analytics center, has to go and update the mapping documents, the risk model algorithm, because of those changes. And they're finishing that up right now. So the vendors have not yet received the documents to move forward with phase 2 certification. That's okay. This year, for this version, we're allowing vendors to pass phase 1 certification, and then after they get an okay from STS to go ahead, they can distribute their software to their sites, to their clients, and at least get sites set up with the data collection using the version 4.20.2. It just will not have the risk scores built in yet. We expect to have those documents back from DCRI probably in the next week or so for the vendors to get build the risk model part and then get tested on that and pass phase 2 certification. I'll show you on the data on the website where you can find that information about where your vendor is at regarding certification for version 4.20. The July training manual will be coming soon. Melinda is working on that, and as soon as we have it, more than likely it'll be posted mid next week for the July training manual. And I'm not sure why I have that in there twice, but that's okay. Important dates for adult cardiac. We have today, we go live with version 4.20. We have our monthly webinar, and then direct data entry is available for those sites who wish to use it. July 15th, we'll have a user group call, which is version 2. It's going to be focused on version 4.20.2 questions and answers. So if you're using or abstracting that form, it's a good place to bring your questions to. And then we'll have our monthly webinar is on August 5th, and we'll have the harvest close is harvest for harvest 2 and 3. So it will be OR dates through June 30th. That harvest closes on August 21st. And direct data entry, like I said, goes live today. If you're interested in learning more information about it, please email stsdb@sts.org, and Jane will be able to get you information regarding that change if you're interested in it. And then we have the dates for AQO. This is just a reminder. AQO was the data managers meeting. It'll be virtual this year. Adult cardiac will be Thursday, October 1st. We have some really exciting presentations planned, and we're still working out the final logistics of it, but it sounds like from what we're talking about, it sounds like it's going to be a really exciting meeting. We will offer CEs for the live content. For live and recorded for folks who purchase to join us on October 1st. Will be offered CEs for those presentations. This is a QR code if you wanted to take a picture of it. I'll leave it up on the screen for a second. That will take you right to the AQO site. And also, abstracts are not open yet. We will be sending out information as soon as we're open for abstract submission. And then AQO 2021 will be in Denver. So we're looking forward to that, and I hope that we get to go next year to all be together. Okay, now I'm going to get into the version 4.20.2 updates. This is the kind of what the email that was sent out yesterday, just letting everybody know that there were some changes made to the data collection forms. Those changes were highlighted in green in the highlighted version that's posted online, and I'll show you what that's going to look like, what that looks like. And we did add in temporary fields. We added back in the 2 COVID fields, which is the temp code and the temp DT, sequence 7230 and 7225. You'll find these in the risk factor section, which I think is section F. It's on my next slide, I think, and I'll go over that. And it's the same rules that we used for version 2.9. And then we added in a new field to start capturing the high flow transaxillary or transaortic devices that are implanted planned intraoperatively. And this section you're going to find, we'll go over it in a little bit more detail. This section you're going to find in the mechanical assist device section. And there's detailed rules that will be in the July training manual to help you abstract this field. I posted up the PROC ID chart, the risk model variable chart, and the risk model endpoint definition. Those are posted online. And then the worksheets are posted. I sent over, there was some printing issues. I think people were having issues with, or problems with the margins being so small. I'm printing the Word version. So I also posted up the, we also, I think, just posted the PDF versions of those forms to make it easier to print. So you could find those online. I am working on a few more aorta. This one is posted. The other ones will be coming mid next week. And then we talked about vendor certification, and vendors are actively, quite a few have already passed phase 1 and have distributed their software to their sites, and phase 2 is has not yet started. So here's the section for the COVID-19 fields. This is going to be found in, risk factor section D. And these are the 2 fields that were added. I took this screenshot from the form that's posted online with the highlighted changes. It has everything else is in blue that were the new. And then I highlighted the additions or the updates from June 29th in green. So these, again, are just the 2 COVID fields that we've been collecting. And then we added this field in for the high flow assist device placed intraoperatively, and it's placed in the mechanical cardiac assist device section in section L. What we're asking here is if the patient had a planned and consented. So the consented means before the patient entered the operating room. insertion of a device that delivered a minimum of the 5.0 liters of flow. This typically is the Impella 5.0 or greater, using an open surgical approach, which is considered to be transaxillary or transaortic during the index cardiac procedure. We want to collect this field to gauge, to look at this a little bit closer to see the risks that this procedure has on the planned index procedure. So we are going to capture this for now. We're not doing anything with it besides analyzing it at this time. And then July's training manual will have very detailed guidance on coding this field for sites. So that training manual should be out in the mid next week. And then I had two small oopses. Whoops. This field, and this is a very small percentage of patients who are not extubated for procedures. This is where this affects that population. So this is in the post-operative section. This is extubated in OR, yes, no, or NA. And NA is for patients who are not intubated during the procedure. If you selected no, this is correct, that you would enter in the initial extubation date and time. However, if you answer NA, this field should not open. It got programmed that way, and it was an accident on my part. But it's a very small number, and to fix this issue, you could just leave this field blank. The total post-op initial vent hours will automatically calculate to 0. So not a big deal. Just leave it blank if your patients were not intubated in the OR. Next one is, I forgot the word native valve here. So this is the pulmonic valve section, and this is the etiology section of the pulmonic valve. This endocarditis was a new choice that was added in, and it should have been endocarditis native valve and endocarditis prosthetic valve. So I just want to point that out. If we find more smaller issues like this, I'm keeping the list, and I don't want to go in and make this one change and then repost it and then have another small change and then have to keep confusing everybody with multiple forms of the data collection form. So I'm just going to point it out here, and if a time comes when we have a few more fixes, we can add it in then to the data collection forms. But just so you are aware that there's two choices for endocarditis, for pulmonic valve disease etiology. One is endocarditis, it should be native valve, and the other is endocarditis prosthetic valve. And then we're going to get into the aorta section. I know that this was really confusing on the last time we talked about it back in June, so I just want to go over it one more time. I said I would provide some screenshots and we'll talk more in depth about it, so that's what we're going to do here. So this is the aorta procedure without aortic valve, and this you have the two questions here. So aorta procedure, and my answers that I'm going to choose are highlighted in yellow. So my aorta procedure performed, any of the yeses, and then valve procedure performed is no. You will not be able to get to this section. So this is just a sole aorta procedure without aortic valve, and that's how you code those procedures, is any yes, whichever yes is appropriate for the patient, and then valve procedure no. And you can't get here because you selected no at sequence 2129. So this is for aorta procedures alone, solo aorta procedures, no aortic valve involvement. And then we have aortic valve procedures without aorta involvement, so the opposite. So this is an aortic valve procedure was done, but the aorta was not touched. So for aortas, I would code this as no. Aorta Prac 2123, I would code that as no. The valve procedure, I would code that as yes. When I code this as yes, these fields down here are going to open up. Code valve, explain it however is appropriate for the patient. And then we're going to look at the aortic valve procedure performed. Yes, you code how you code any of these yeses that's appropriate. And then the next question, was a procedure performed on the aorta, and you're going to code no. So when you answer no, will open the aortic valve only section. So you only, if this procedure, if you're coding an aortic valve procedure and there was no aorta involvement, you have to make sure you code no to this, was a procedure performed on the aorta, no. This no field is what's going to open up the operative section of the aortic valve. So you have to code that. You would code yes here, no here. Make sure this no matches the no up here on the other aorta procedure performed section. Okay, there's going to be a quiz on this, so pay attention. And then we get into the, let me make sure I'm not missing anything here. Okay, so then we get into, this is an aortic valve procedure and an aorta procedure. So my aorta procedure performed, I have all of these coded as yes. My valve procedure performed, I have it coded as yes. And then my aortic valve procedure down here, this is the aortic valve section. I have one of my yeses chosen. Oops. Sorry, I'm not sure what I did, but, oh, I went to the wrong, hold on, sorry about that. I went, and then, so my aortic valve procedure, I have one of the yeses chosen for aortic valve, and then there's a confirmation question. Was a procedure performed on the aorta? And I'm going to code yes again to the aorta section. This will allow these two yeses, they need to match. The aorta procedure performed up here and the aorta procedure performed down here. When those two answers match, you're going to open up, M2 will open up, which is the aorta procedure section. And that's where you'll capture both the aorta and the aortic valve for the combined procedures. So again, this is for an aortic valve with an aorta procedure. Aorta procedure performed, any of the yeses. Valve procedure, yes. Aortic valve procedure, any of the yeses. Confirmation that yes, a procedure was done on the aorta, M2 opens up. Okay, now here comes the tricky one. What happens when we have accidentally code something that's inconsistent? We have an aorta procedure performed. We coded this as no. We coded that there was a valve procedure performed. We coded the yes for a valve, the aortic valve procedure, and then we coded an aorta procedure was performed. But these two don't match. They need to match. 2123 and 2132, they need to be consistent with one another. So this isn't, don't do it. It won't let you go any further, and it confuses the system, and you're going to get a message that says there's an inconsistency and please correct it. Okay. So now here's the polling question. Let's see if I can open it up. There we go. So here's the polling question, and I want to know, is this okay? So I have aorta procedure performed, no. I have valve procedure performed, yes. And then I have an aortic valve procedure performed, yes. And then was a procedure performed on the aorta, yes. So my choices are, yeah, of course. How else would I code an aortic valve procedure with a root? Or, no, I need to code both sequence 2123 and 2132 consistently. If I say yes in one place, I need to code yes in the other. If I say no to one, I need to say no to the other. And let that run for a little bit and see how we do. So far I have lots of hope that we're going to get this aorta section. And I see a question in the chat box down at the bottom. We're just getting to this section, and it says, where do I code a Bento procedure? So Bentos are pretty similar to aortic valves with roots. So that's what this question is asked. That's kind of what I'm getting at. Are these Bento procedures? So how would I code this Bento procedure? And this is just an example. I have aorta procedure performed, no, but I have yes to the valve. And then I say yes to the aorta because the patient, we did a Bento. So is this correct? I'm capturing those types of procedures. And I think we're pretty good. We got a good turnout for votes. I'll leave it open just for a few more seconds here and then we'll go on. Okay, I'm gonna end it. And there are the results. So most people got it right. This is not okay. You cannot choose aorta procedure performed no, and aorta procedure performed yes down here. I apologize. I guess the guys are gonna cut the grass now while I'm on a webinar. Sorry about that. I hope it's not too loud. So that does not work, and that's get a sad face, Mr. Yuck face, sad. So that's that one. So good job on getting that right. Thanks for listening. Okay, and then now I'm going to hand it over to Melanie Bent with the Iqvia update. Melanie?
Thanks, Carol. And hopefully you can hear me clearly.
Yes, we can hear you.
Perfect. Okay.
Yes.
All righty. Thank you. Let's go ahead and let's cover a couple of updates that we have for Iqvia. Let's go to the next slide. The first thing that I wanted to raise was an issue that did impact the adult registry yesterday, and we do apologize for any inconvenience that may have caused you. We have been able to rectify that, and it is back up and running. Sites were receiving, if I have some users that did not go into the system during that time, we did have an issue where sites were uploading and were receiving an internal server error. And so this did impact across many sites. So again, this has been resolved. We did get different support calls related to it. I had some of those IDs that are listed here in regards to what was reported to support to the dev team. But again, all of those have been resolved. A couple of other items that I wanted to just raise. These have not been officially posted to the notification section. We are reviewing items that have come in. Potentially these may impact more than one users. There are more in the list. Many of those are respective to an individual site. So we are reviewing those items at a site-by-site basis and looking at the individual scenarios, whether it be the DAT file information that's being sent related to what is being shown on report. But just know that this list, if you do not see an ID that may have been provided to you, please know that we are still reviewing items that have been escalated to development, and know that your item will be reviewed and we will be back in contact with you. But for a couple of items that we wanted to go ahead and at least share, just in case if others were experiencing some of these similar items, wanted to just highlight that these are in the works and being reviewed. And of course, if identified as an item that has to be fixed within the platform, it would be fixed within a release. If it's an item that is just respective to the site and we're able to resolve individually via maybe an re-upload of a file, we're handling those again by case basis. So just wanted to raise these. Once the confirmed list has been updated, we will be posting and sharing, because I know I do have some vendors that are also on the call, most likely. We'll be sharing that information via the platform, and also for the vendors, we do have the distribution list. We'll be sharing that information with the vendors also. Okay, so just wanted to give this update. We did have a past update over the weekend that included some new functionality, and specifically I wanted to call out a new report. In addition to that, we of course are prepared to receive the 4.20.2 information within the platform. So we did do all of the preparation in regards to being able to receive those files once the vendors have certified. So that also happened and was released and available within the platform over the weekend. If we can go to the next slide, I wanted to share a new report that is now available. Some of you may have seen a new tab pop up. It is available within the existing data quality report, and it's available as a new tab. So if you were to review any of the entries that you have on that upload history section of the uploader screen, you of course can navigate to your data quality report submission by using the view report. Open that, and once you open that data quality report, you'll see at the bottom left, there is a new tab that is available that is called Critical Summary. And on this Critical Summary report, you will be able to enter in a specified date range. So you'll notice to the left of the screen, underneath the submission data filters, that there is a from date and to date where you can go in and specify a submission time frame that will generate the report. Once you enter in that criteria, you would then hit the Run Report option. You'll see that button right underneath there. And then you'll see that once it generates, it is going to allow you to see all of your submissions for that time frame. And the great thing about this report, which some have been asking for, is being able to see within those submissions, is there a way for us to review the first surgery date, that record, that very first surgery date that's in that submission, through the very last surgery date. So you see that you have that range available within the report. And also it's going to give you the status of that submission, whether it failed or whether it passed. And another thing that users have been asking for is, can you just tell me the total number of records that were submitted? And we wanted to be able to provide that information to give you the total number of records and then give you the breakdown of how many of those records were successful, how many of those records actually failed, and how many of those records did not change in one shot, just to give you a visual. And you're able to see, again, based on the dates that you entered, all of that summary level information here. Another thing that you'll be able to get to is the actual submission. So that DQR, that original DQR that's associated with that entry, you're able to navigate to that report with this hyperlink. So gives you, again, a one-stop shop of being able to see this information, access that information, and review that from this report. Another thing that the report will be able to provide is if there are any current critical summary validation messages that are associated with the submission. So if you were to select one of the failed, for example, if you were to select that entry, the failed would then show you the status, whether if it encountered an issue with loading the file. So you would see a validation message that's listed down below to give you a high level. The other thing that you're able to get to here is seeing, instead of going to the individual, if you were on the uploader history window, scrolling through to see, okay, where are the critical summary, which ones had the critical errors. You're able to see immediately here items that were uploaded, and if there was an entry where it had failed records, you could select that. You could go to that actual DQR and you can see those critical error messages that are in that submission and be able to review that. If you have subsequent uploads that have corrected those criticals, then those would be resolved. It would not appear again. So you would be able to see real-time updates in regards to those uploads for critical errors if you've already uploaded and corrected those critical messages. So just wanted to share with you that this report is available. If you have not taken a look at it, you can go ahead and view it now. It's available for you. And just wanted to let you know that we will continue to update the platform and bring more, features and functionality. And again, another big win for us in regards to launching the direct data entry. So July 1st was the target, and July 1st we are able to take on any new users that would be interested in direct data entry. And as Carol had shown in a earlier slide, the contact would be stsdb.sts.org to get more information about that. And that's respective only to the ACSD registry and GTS registry at this time. So those registries are ready for that feature functionality. And I think this is the last slide that I have, Carol. Let me just double check. I think we would go into support. Yep, we're going into
Great,
support.
Melanie.
All right, so thank you so much, and Carol, back to you.
Thanks, Melanie. Thanks for the update. So this is the Iqvia support plan. You can call or email Iqvia. They'll put it to the tier 1, and they will give you a send you an email letting you know if they are unable to resolve it at tier 1. They'll send you an email saying it was closed at tier 1 and escalated to tier 2. That email can be a little confusing the way because it says it's closed on there, but if you continue reading, it'll say that it's escalated to tier 2. And then we handle it, or Iqvia will handle it over at their side, or STS will handle it, and then we'll get you an answer hopefully pretty quickly. When it goes to tier 2, it may take longer than 24 hours, depending on how complicated the issue is. And it will, inquiries received outside of the life support hours will require a 24-hour turnaround, which is 1 business day for responses. So if you submit something at 3 p.m. on a Friday, you probably won't hear back until Monday afternoon. Your resources are the STS National Database page, STS Tech Support at Iqvia.com. That's where you would email if you had uploader, DQR, missing variable, the harvest summary report, dashboard, or password and login questions, and their phone number is there. And then here's my information, ccrone@sts.org, and the STSDB@sts.org for operational questions. And right now, probably more people are interested in direct data entry. You would email the STSDB@sts.org. And I wanted to say happy 4th of July. We're going to get to questions here, and I hope everybody stays safe over the holiday weekend and enjoys it with families in a safe way. And now we're going to go over to the questions and answers, and we'll get through as many as we can. Not too bad. I'm going to pull this, let me make the screen smaller here. Oopsie, hold on 1 second, please. Okay. Let me pull this over because we're going to get, this is the aorta section. Because I saw some questions come through, so I'll have that pulled up. All right, ready, Melanie and team? First question, is there a way to get a spec document of parent-child fields for the operative procedure section? We are having trouble getting all the aorta sections to open. So I'm not sure what you're asking there, but I'm happy if you want to email me, I can get you what you need. Oopsie, went too fast with my mouse. ccrone@sts.org. Next question, my physicians are asking when the 2019 executive reports will be published. Thank you. So Melanie or Iqvia team, any idea when we'll have the Harvest 1 reports from 2020 available?
Hi, it's Melanie. So we're still working with getting that data back from DCRI. It is still with them at this time. Once they have that information ready to send over to us, then we will be preparing that data and, of course, surfacing it in a new report. So right now, we're currently still in that process of coordinating with DCRI.
Great, thank you. And Melinda, you might want to hop in here, I believe. I just want to make sure I got it right. So can you clarify from the last webinar that if we do not have an echo, we should document no for any valve regurgitation questions and no for any valve disease? Are they required to have an echo to code those fields?
Well, there's only 2 answers, yes or no. And historically, if there's no indication that there's any regurgitation or any stenosis, we've always said to code no.
Right, and that's not limited to just having an echo though, right? It could be found, regurgitation or stenosis could be found in a physician's documentation.
Or a cath note.
Right.
Or, you know, a stress echo. I mean, it could be found in a lot of places.
Yeah, so not if you don't have an echo, it's not a reason to code no. You just have to look to make sure any of those other sources, and I think we have a list of sources in the training manual that you can, might be as a kind of a guide to help you with that question. But just because you don't have an echo doesn't mean you code no. Next question, with the move to remote working, we've been challenged with not having forms because of protected health information at home. What are other locations doing to protect information? Are any of the hospitals totally paperless for abstractions? So there are some paperless abstraction sites who just do it directly into their vendor software. They do not have, do not collect on paper data collection forms. I guess if you're going to collect it at home on a paper form, you would just want to leave off PHI and make sure that you have an identifier. If you're saying that you are not able to enter directly into the vendor software on your paper form, I would put the either there's like a record ID that's generated when you start entering it into the vendor software, or you could put down maybe the date of service and patient's initials so you can find them easily. But I'm not sure exactly, I'm not sure if that's helpful or not for you. I guess a way to identify that patient, so when you're entering them, you know who they are. And then I think that you have to destroy those paper data collection forms if they have any information on them, if you have them at home. And I would talk to your HIPAA compliance officer at the location where you're abstracting for, and get suggestions from your HIPAA compliance officer on that. What is the benefit of using the surgeon worksheet versus the surgeon utilizing the sections on the actual DCF form? You could use whatever works for your surgeons. If the surgeon worksheets work better, they're kind of a condensed form of things that the surgeons would be knowing in the operating room, versus all of the information that includes the perfusion and anesthesia fields on the data collection form. So it's condensed and more focused to the surgeon, but you use whatever works for your site and your surgeons. Will there be a surgeon data collection form for other procedures? So I wanted to show, I'll show you where to find these at. So this is the Registries and Research STS National Database, Adult Cardiac, and then Access Data Collection Forms. Under version 4.20, here are the updated data collection forms. When the July training manual is posted, it will say updated July 2020, and that should be next week. And then we have the surgeon worksheets. We have all of the procedures listed. I'm working on a few more aorta ones. This is the aorta open dissection, open repair of a dissection worksheet. And the other ones will be coming soon. And then we have all the other forms here, the data specs, risk model stuff, Proc ID, and case inclusion guide. So that's where you'll find them, and there will be more coming. Only enter COVID date if the test is positive, correct? So yes, that's right. And this is the highlighted form. And I update, the green highlights are the fields that were updated on June 29th. So the 4 that were added, I think, or 4 changes are these 2 COVID fields, which is the same, we're collecting them the same as version 2.9, and you code no here if the patient did not have a test or if they had a negative test. And then the date of positive COVID closest to OR, and again, this is the PCR testing that's performed, not antibody testing. So yes. Okay, if a 5.0 device or greater is inserted along with the cabbage, does this remove it from isolation? No, it does not remove it from the isolated cab category. You capture these 5.0 devices. Let me show you where that's at. So in the coronary, this is just another, we removed this 11 none because that doesn't belong there in the distal site. So that was just one of the small changes I made. That was made. Okay, and then we get down into, this is the mechanical assist device section, L, right underneath the valve section. And the question is, was a planned and consented insertion of a device that can deliver a minimum of 5.0 liters, these are Impellas 5.0s or 5.5s, I think, or greater, using an open surgical approach, so transaxillary or transaortic, performed during the index cardiac procedure, yes or no? These devices, these Impella devices, are also going to be captured here in this temporary assist device used category. So you code, if it was an Impella 5.0 or greater, you code it up here as a yes. If it was implanted open or surgically. Again, refer to the training manual because there's a very long definition with clear guidelines on how to code this field. And then all Impella devices get captured in this temporary assist device used section. This does not remove it from analysis if it's performed in conjunction with an analyzed case.
Carol, can I add one comment about that?
Sure.
Just so they know, it's not in the training manual yet. It will be in the one that we post next week. So in case you want to go look for it, it's not there yet.
Right, it'll be in the July training manual. And I think that was on the letter that came out, July training manual. So it'll be coming soon, and we'll give you clear directions when it's posted. Next question. Is there a webinar video that shows how to add a patient in the 4.20 version starting from the beginning, and how to on how to add patient, enter chart, and navigate the site as far as the risk scores and validations? I have watched a technical person who buzzed through it so fast that it was impossible to follow. It is assumed we have knowledge of the site, which we don't, and that should be taken into consideration. So Kathy, I'm not quite sure. I don't know if you're referring to your vendor software or something from STS. If you're referring to your vendor software and how to enter a case using your vendor software, you'll need to reach out to your vendor. If it's about direct data entry, please email stsdb@sts.org, or if I totally misunderstood your question, please clarify in the Q&A. Okay, this is why I had opened the form. So the next question, there's three questions here about the aorta section. The first is, how do you code a valve resuspension with the replacement of the ascending aorta? So I have a aortic valve resuspension, and I have a procedure on the aorta. So we're going to this one, aortic valve with aorta procedure. I'm going to code, this is the operative section. So I code the aorta as yes, I code the valve as yes, and I again confirm that a procedure was performed on the aorta. That's going to open up section M2, which is the aorta section. You enter all the preoperative information in the aorta section. And then when you get down to the intervention section, you'll see here, hold on. It's going to ask you again, was an aortic valve or root procedure performed? Yes. That's going to open up the valve section within the aorta section. So you have, it was not a replacement. You're saying that a valve resuspension suture was put in, which is captured here in the, which is captured here. And under the aorta section, under the aortic valve section, which is held in the aorta section, you're going to capture that resuspension suture along with the replacement of the ascending aorta. So it's all right here. The next question is similar. It says aortic roots go under aortic section and annular enlargements procedures go under aortic valve section. No, you're going, not exactly. So the root procedure, again, it's going to be, you have a procedure done on the aorta and you have a procedure done on the annulus. Within the aorta section, you are going to capture the annulus enlargement and you're going to capture the root procedure. So this is all under the aortic section, aorta section.
That's if they actually do a root procedure with an annular enlargement.
Well, that's what it says, aortic roots. That's the question, was an aortic root procedure with an annular enlargement.
Right, I just wanted to clarify that because when I read it, I perceived it differently.
So if you do an aortic root, if you're talking about two separate procedures, one is an aortic root that's going to go under the aorta section. And if you're talking about a totally separate annular enlargement procedure, no involvement of the aorta, then that goes under the aortic valve section separately. If it's a procedure on one patient done in the same entry to the OR that involves the aortic root and an annular enlargement, that whole procedure goes under the aorta section. So I missed what you do if it's a Bento. Can you go over that again? So that's, the Bentos are the root procedure. So you capture those, you capture the valve under the aorta section, and you capture the root under the aorta section.
I think the confusion might be is the word Bentol is not on this data collection form. So if you could see right under the root procedure, it says root replacement with coronary osteal reimplantation. It used to have a parentheses like Bentol. So that's where it goes.
Okay, Melanie, this one's for you. How recently was the uploader issue resolved?
It was resolved last night. So the notification was posted. I believe they got that deployed. It was posted this morning to notify that
this is Jeanette from Iqvia. It was posted last night at the time the fix was available. So if you ever are experiencing an issue like that, we would definitely encourage you to check the notifications area. If we are experiencing sort of a broad impact item that's confirmed, we will certainly post an update there as well as confirmation when it is resolved.
Great, thank you. Next question. Oh, we already did that one. Can you go back to the slide showing no answers on the aorta? I think this is the one you're talking about, so I'll leave it up for a second. Melanie, I have an Iqvia case. 4 patients in February and 4 patients in March all died in the hospital, but the missing variable report shows them as date of discharge as missing. Any updates on that?
Yes, and I thought I added it on the slide. I'll make sure, but that is STS 3186. So we do have that on the list we do have a fix. We just have to target when that release will be going out. So we do realize that at this point, if anyone else is seeing that on the missing variable, that is STS 3186. And we will be getting a fix out for that. We'll be communicating when that will be issued. And of course, support will be contacting those that had called in regarding that also.
Great, thank you. Next question. Could you produce a report that shows how many cases I have submitted by procedure category and date of surgery? Current way I'm doing this is very cumbersome, but only way I know to make sure my information matches my internal database. I think this is the harvest summary report. And is that right? And can we sort by proc ID in the harvest summary report?
No, we can't sort by proc ID, but you could use the dashboard where you are able to review by procedure category. You're able to filter within the dashboard by procedure, by the date range, surgery date range, and that will give you, let me just try to see. I don't know exactly. It will give you the total number of cases that's available by that criteria. But I am not sure if you need something even more granular than that. But the dashboard would give you, I think at the surface of what I'm understanding, that information specifically, by procedure and the cases related to that with case count.
Great, thank you. Can you show us how you got to the data quality critical summary?
Let me see if I have it open.
I think it was in the slide.
Yeah.
If you could show the slide again.
If you show the slide, but how to get to it, it's going to be via the upload, the same workflow of how you upload and you have that card available and how you navigate to your data quality report. So you would just open an existing data quality report and you will see that there's a new tab at the bottom left, which is called critical summary. So that'll be available for every submission entry.
And it's that red box in this photo here. So if you just open your existing data quality report and then just click on that tab with the critical summary words on it, it will bring you to the critical summary view.
Great, thank you. We need to know if, as of today, how many records are there and how many and which ones still have errors we need to fix, please, and thank you.
That's your harvest summary report.
Yeah.
Yeah, that will give you the information that you're looking for.
Where will I see that record and if it's now clear? That's the harvest summary report.
The harvest summary report, exactly.
Yeah. In this version, how do we prepare our records for the export file? Where do we run the risk to create the export file? So I think you're talking about version, I'm not sure here. If you could clarify, I'm not quite understanding the question. If you could clarify it in the Q&A or send me an email, I'll try to get that answered for you. Sorry about that. If we have a critical error, can we fix it in Iqvia, or do we need to use our third-party vendor software and resubmit? You need to fix it in your vendor software and resubmit. You won't, if you have a critical error, it won't even populate into the Iqvia platform. Is the data quality report critical summary available for thoracic surgery database?
Yes, it is. It's available for all three registries, all three databases.
Great, thank you. A patient has a 60% left main with all other vessels on the current cath less than 50. Oh, sorry, a patient has a 60% left main with all other vessels on current cath less than 50. Patient has a history of PCA and RCA in the remote past. If once diseased, always diseased, I am to mark the number of vessels of diseased as 3. When I get to the RCA distribution, do I mark yes, no, or NA as no current disease present? If I mark yes, do I leave the percentages blank? How do I do it so I get data in incongruity? Let's see. I'm going to scroll up to let me get up here. Okay. All right, so I have a patient that has left main 60, so we code yes here, and then do I know the location, and it's the native artery, and then it says with all other vessels on current cath less than 53, patient has a PTCA to the RCA in the remote past. If once diseased, always diseased. And I think Melinda, for this vessel, for the RCA, it's less than 50%. We know that. So we're going to code it no here, correct? And then when we get down to, or when we code the number of diseased vessels, are we coding that as?
It would be 3 vessel disease, because once diseased, always diseased. So it's 3 vessel disease.
So we captured the left main is greater than 50. That's 2 vessels.
Mm-hmm.
And then the RCA that was had a PTCA to a PCI place, we code that as the 3rd vessel.
Right.
And
now, my only other question is, the PTCA was done in the remote past. I'm assuming maybe they had a recent cath that mentioned the RCA. I'm hoping. That's my only missing variable here, because my first suggestion would be to look at your most recent cath and see what the stenosis or non-stenosis was in the RCA.
it says less than 50 on all other vessels, so I would code that as no for RCA distribution.
Yep.
Okay. So you code it as number of diseased vessels 3, left main is yes, and you code the left main, and then the RCA you're going to still code it as no, even though it is considered to be diseased. You don't have stenosis greater than 50% in that vessel.
Correct.
Okay.
And I'm assuming this is for version 4.2. I'm looking through all these questions, and I see that that first echo question caused a lot of confusion, because obviously they were asking the question about version 2.9, and I was answering the question about version 4.2. So I'm assuming this is for, so really important, guys, when you're asking these questions, let us know what version you're talking about so that we can answer properly.
And I'm answering questions as they're to the current version, which is version 4.2. If you're not talking about 4.2, like Melinda said, you need to clarify it. How long does it take to post these webinars on the website? So they should be posted. This one will probably be posted by Tuesday because of the holiday weekend. Is an aortic root procedure coded as an aortic valve procedure? Not in version 4.2. It's captured in the aorta section. Where doesn't what does direct entry mean? Is there a charge to if you are interested in more information, please email stsdb@sts.org. Could you tell me which phone call date covered the operative section of the DCF? I need to review it. Not really sure. It was probably May. It was either I think it was May that we went over the operative section. There's PDF slides posted, so if you want to just scroll through the slides really fast and see if the operative section is on there, you'll be able to find it. Can you again briefly show the slide with the deadlines? So I think you're looking for the date slide. This slide, I think. How do we find out if our vendor has passed the certification process, right? So here is the, on the STS website, it's under registries and research, and then the STS national database. And if you scroll down, do not click on any of the databases, just scroll down right on this general database, national database page. And under here where it says join the database and become a participant, there's a list of, hold on, it's opening. It's gonna take a second, I guess. It's giving me a hard time. This is the page and it says under how to participate. So this is the become a national STS database participant, and then under how to participate is the list of certified vendors. And this is the 4.20 mandatory as of July 1, 2020. And I know ARMIS has certified, so you'll see here that they've passed phase 1. So it will be listed on that sheet there. Was there a webinar that went over sections A through H for newer data managers? Yep, we started back at the end of January going over all of the sections, and we completed that on our last call the end of June. So there's the webinars for version 4.20. If you're looking for recorded webinars, again, under the STS National Database page, scroll down just a little bit and you'll see the live webinars, view webinars. Adult cardiac is listed first. And these are all the upcoming webinars. And then we have this webinar. We do not have a July 30th data specification webinar because we're done with going over that. So this will be removed, but we do have a webinar on today and we have one on the 15th, and then the beginning of August will be the next webinar following July 15th. Under past ACSD webinars, you can go straight to the ACSD webinar YouTube playlist, or we have some of the most recent ones posted here along with the PDF slides. Shouldn't we be coding not documented if there's no documentation regarding regurgitanosis on valves, right? We didn't say don't code not documented, but we're saying that if the echo is, if you're asked, if the question was if I have an echo, or if I don't have an echo, do I code no to everything? And what we're saying is that it's not just dependent on if you have an echo or not. There's other source documents that you can be using to look at regurgitation and stenosis for the valves. So it's not that we're telling you to code not documented, we're telling you to look at all of your sources and then code appropriately according to the version definition that you're abstracting for.
Yeah, can I just throw in something else in? Because obviously not documented choices for regurg were on 2.9. In version 4.2, there's basically just yes, no questions that are parent. So the other thing is that historically, and that's also in the version 4.2 training manual, is that when you have documentation, a history of physical consultation exists in the record, you've got stuff in the record and things are not specifically addressed, then you code no. So if you're in a record, you've got no evidence that that patient has aortic stenosis or aortic regurgitation, you've looked at the entire record, just answer no.
Right, and I think people haven't looked at version 4.2 or don't, are getting confused between 2.9 and 4.2. So this is the 4.2 document data collection form for the valve section where we're talking about the hemodynamic and cath section. The section has changed. So make sure you're looking at this section abstracting correctly and review the training manual as you're abstracting. When you get down into the valve section, aortic valve section, the first question is, was there valve regurgitation, yes or no? If you have documentation of valve regurgitation, you select yes. No documentation, you select no. No. If you have documentation and there is valve regurgitation, you select yes. If you have documentation and there is no valve regurgitation, or you do not have a documentation, you select no. Is that correct, Melinda?
Correct.
And then if you select yes, then you code what type, what level of valve regurgitation. If they just say that the patient has valve regurgitation and they don't quantify it for you, meaning that they don't tell you if it's trace, trivial, mild, moderate, or severe, then you would code that as not documented. Same thing with stenosis. And this is all really, if you review the training manual, the training manual is posted for 4.20. It was posted in June. There will be an updated one coming out next week, but this is in the current training manual that's posted online. So I guess that's the next question is, I think the question regarding no echo is asking that if we don't have the information anywhere, do we code no to regurg, stenosis, et cetera, or leak blank? So if you don't have any documentation or the documentation is negative, no, then you just code no. And I think this is going to be our last one. We're over a few minutes here. Are the surgeon's worksheets complete or more changes made? So what's posted online now is available. If you want to make changes, it is posted. Posted them both in, let's see if they're posted yet in PDF. She was working on it. Not yet. So they're posted in Word now, and you can go in and pull them up. It'll open up down here in your box, and you can make those changes however you want, but they're pretty complete now, and the PDF versions will be posted, so they're easier for printing. And let's see. I think we're going to end. Any questions in here you thought would be helpful before we go, Melinda?
I'm just trying to go through them real quick. There's so many of them. I don't think so. The only thing, there was one helpful comment from Crystal about she's working remotely and she has PHI at home and she's following the guidelines to keep it locked up when not in use. And honestly, that's how I've worked for 10 years now. So I definitely check with your HIPAA officer at your site facility and see what the guidelines are for that.
Right. Okay. All right. Well, thanks everybody. If you have any specific questions about version 4.2, you can send an FAQ in to Melinda and we'll work through those. The mailbox, I'll show you where that's at in case you aren't familiar with it. On the sts.org website under Registries and Research and then STS National Database, do not click the buttons at the top. Just scroll down a little bit and you'll see clinical question request form. When you go to ask a question, just click here and it'll pop up. That'll ask you some basic information. It's going to say that we'll get back to you within 30 days. Usually it's much quicker than that, but sometimes we have to run things by the surgeons to get make sure we have the good answers for you. So, no, the correct answers. So when you fill in this, your participant ID is a 5-digit number for adult cardiac that's going to start with a 1 or a 3 and be 5 digits. And then you're going to select the database version. Make sure you select the correct database version. Version 4.20 is down here, 4th on the list. Make sure you select that so it goes into the correct mailbox. Otherwise, it will get mixed up with these 2.9 questions. And we want to make sure that we give you the definition that corresponds to the version and that we're clear. So that's how you would pick that. And then the sequence number is helpful so we can keep track of the sequence number. Don't have to worry so much about the short field name, but it is helpful if you don't mind typing it in. That is helpful for us to make sure that we're talking the sequence and short field name match and then type in your question. You should get a response back saying that your email was accepted in. Sometimes I think sites have blocked STS from sending these confirmation emails, so you may not get one. But I think most people are getting them back. So do not include any patient identifying information in here. Just make sure it's all de-identified information and then send it in and we'll get back to you. Melinda will get back to you, or we'll have to talk to the surgeons if it's a tricky one. So I think that's it. Anything else, Melinda, Melanie, Jeanette?
No.
Okay. All right. Thanks everybody for joining. I hope you have a great rest of the day and a nice holiday weekend.